Those criteria have to be defined upfront to make it a fair process. Everyone has to know what endeavor he's going to enter at the very beginning. So we have to define the criteria, progression criteria for the screening process. That's part of, again, a full project proposal that cannot be accepted at this very, very early stage of the project.
Okay, do you have any more questions? Oh, we have one right at the back.
Thank you. David Cronk from Biofocus. Listening to the discussion here, it seems to me as if the real value in this initiative is the novelty of targets coming through from the academic sector and the compound collection that will be assembled from the various pharma partners. Question for the panel is, are we trying to make things more complicated and challenging for ourselves in re-establishing screening centres that already exist within the industry and really just focus on the front and the back end of the project rather than trying to build a new technology centre?
So the question is, why doesn't industry take over this task of providing the screening centre?
What I'm suggesting is that there are a number of existing screening centres out there that can provide you the screening expertise and technologies that you need. So why not use them to take your targets and screen the collection that you're proposing to assemble rather than reinvent the wheel from scratch? Because the technologies are there in multiple places throughout the industry.
I completely agree. This application process is going to identify the most suitable, probably existing screening center to take over that responsibility.
But I guess
with the restriction, it has to be eligible for IMI funding.
But probably if you take the sum of the skills that sit within the various parts of the industry, screening centres throughout, within the various academic centres, you're going to be able to cover far more technologies than you can by building that from scratch in very challenging timeframes. I think that everybody accepts that you have here.
Well, it really comes back again to this question, how many centres that we have discussed before, if I understood it this time correctly.
I think it's, the other thing to remember is that IMI projects are about bringing together the skills from diverse groups and diverse public bodies. And what this project isn't doing, it isn't funding infrastructure. It's trying to build a collaborative network of individuals or applicants who will be able to address all of the objectives in the call. And they can be from many different backgrounds, whether it be screening centres that already exist, or groups and SMEs that are working on novel screening platforms. The whole idea is to bring together a critical mass of expertise that will actually address all of the objectives in the call. So we're not trying to fund a rebuilding of an infrastructure. We're trying to utilise what is there in a better way already. Are there, sorry, I was so busy talking I wasn't paying attention for if people had their hands raised. Are there any more questions? Oh, I shouldn't have asked.
Just a very quick question. Frank Heemskerk, independent advisor here. Everybody is, of course, focused on the positive results, selecting the right targets, the right hits that can be commercialized or otherwise find their way to the market through a public developer. What about the negative results? Because here we are talking about a consortium approach. You have now for the first time the possibility to pool results about what works and what not works to avoid that people select targets again that have been proven in the past not to work. Is there any policy or agreement among the FPA partners to give access to the negative results on targets on validation?
Negative results, we have a lot. That's the problem. I think within the context of the European lead factory, one idea really is to share both the lessons that we have learned from the success stories as well as the failures. The question still is, what is the message that you really bring across doing that, taking somehow still limited library, for example, screening that against the target, won't tell you much about the general feasibility and likelihood to come up with a lead structure taking a different library. It's still a judgment on your own that you have to take, but that information will be available. If you come up with tool compounds, yeah, of course it would be an interesting aspect, and I think we should take that on back into the project, that we also collect the possible negative results on a failing in validating a certain target in a certain pathway, for example. Yeah.
Actually, just let me explain why I asked the question, because we see a lot of screening in academia on targets that have not been validated clinically. Mm-hmm. While many pharma companies in FPR have that knowledge, which targets could be clinically validated, and it would be very valuable if that is shared with academic groups.
Absolutely agreed. Yeah.
I think as well one of the outcomes of the European Lead Factory is that the screening centre will be an interface for interactions with the wider academic community. So there should be an exchange of information and ideas, and it's not just going to be static bricks and mortar, and they're going to have it'll be fluid and changing, and hopefully innovative ideas will be able to come into the screening centre at different points.
Walter Luijten, KU Leuven. I have another question. The aim of the compound collection is to explore novel chemical space. That's very interesting. Increasingly, people are using in silico screens based on known structures of targets to identify a small set of attractive compounds for testing. So it would be very interesting for those virtual screening people to have access to the new chemical space that you're trying to open up. Is there any way that you envisage that these people will get access? Because that would leverage enormously the collection that you're trying to build.
Well, technically there are a couple of possibilities to spread that information in terms, for example, of descriptors like fingerprints. Yeah? Whether they are suitable really to give that type of information that you are thinking of, I'm not so sure in the end. But we will try to find ways to provide as much information as possible. In the end, we have to balance the one goal with the other. If we want to provide a basis for a business model and sustainability for the screening center, that would be one aspect. Yeah. Having that has to be balanced against what's the value in spreading that information more widely. Yeah. Again, I think this is something that has to be discussed in detail over the next couple of months, and in particular once we have really assembled the full project proposal, the full consortium, and to work our way to the full project proposal. I can see that as a possible value. We have to balance that with maybe conflicting interests in that context.
Okay, are there any more questions? If not, I'd like to thank Jörg for addressing most, if not all, of the questions and some of the comments that were made today. I'd like to thank Magali and Georges for joining us. I was expecting lots of administrative questions because you all kept me from my lunch today asking me administrative questions, so I must have done a good job. But they will be available for the rest of the afternoon if you want to actually discuss more specific financial and IPR questions with them. We will be launching the call text, we hope, in early March, and the date currently is the 6th of March. So have a look at the website because all the updated documentation should be available then. From this point forward, please feel free to network this afternoon, but after today and after the webinar, if you have any questions, please direct them towards me rather than directly towards Jörg and to the members of the FPA team that are here.